everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. In this episode we're going to be talking about how to treat armpit pain after you've had breast cancer surgery. So the first thing I wanted to discuss in this video is that the armpit is one of the most common areas that my patients will tell me is their most painful spot. So this is the reason I wanted to create this video, because it's a really common issue for breast cancer patients and breast cancer survivors if they haven't had this problem treated. So one of the first things I want to talk about in this video though is what we're not talking about today. So what I mean by that is this video is not talking about armpit pain in relation to, say, seromas. Seromas are trapped pockets of fluid that often occur after surgery, and they can actually form in the armpit itself. The other thing that can form after surgery is just a general build-up of post-operative edema. So edema is the technical term for swelling. So women and men who have breast cancer surgery can end up with a build-up of general fluid under this armpit region. So we're not talking about seromas, we're not talking about fluid build-up in the armpit, albeit these things that I am mentioning here, guys, are things that can contribute to pain in the armpit, but specifically what we're going to talk about today is scar tissue pain that forms in the armpit. The other two things that we need to be conscious of with armpit pain after breast cancer surgery is infection in the wound near the armpit. This is not a very common problem that I see, but it can happen. So if you have any signs of infection in your wound, which would be redness, pus, heat and a lot of pain, particularly if it's in that first couple of days or week after your surgery, it's definitely time to get to your medical team and get them to have a look at the wound. If you're looking at your own wounds and they're looking a little bit average, then I would definitely go and get your medical team to check out the wound, because there's a possibility there's an infection there. And the last thing I wanted to mention as to what we're not talking about in this video that can cause pain in your armpit is cording. So I've done 3 videos on cording. I'll just put a little tag up here now to one of the first videos I did about how to resolve your cording after breast cancer. Cording can cause discomfort and tension in the armpit, but as I said before, I really wanted to hone in on the problem that is scar tissue forming in the armpit and causing pain. So first of all, let's talk about why scar tissue in the armpit can become a problem. So when you've gone through breast cancer, the large majority of patients who have breast cancer will have at least one lymph node removed. So if you've had a sentinel node biopsy, that means you've had 1 to 2 or 3 lymph nodes removed in your armpit. And an axillary lymph node clearance or axillary lymph node dissection means you've had a lot of lymph nodes removed. So if that's the case, unfortunately the nature of surgery means that they've gone into your armpit, they've had to basically dig around and look at the lymph nodes and get the lymph nodes out that they're not happy with. So that creates a fair amount of trauma to the armpit region, and ultimately that's going to cause scar tissue, not only from the surgical scar, but possibly also from a little bit of mucking around that they really have to do when they do the surgery. So when you first come out of surgery, the wound is healing. So there's no scar tissue really formed at that first point where you get out of surgery. It's after probably 2 to 4 weeks that the scar tissue starts to really consolidate itself, and it's usually beyond that point that people may start to feel a tightening or a general soreness in their armpit. Now, as I mentioned at the start of this video, there's a number of reasons why armpit pain can occur. So probably the first most important thing is if you've got reasonable amount of armpit pain after breast cancer surgery, make sure that you're going to see your medical team, because there's so many different reasons armpit pain can occur after breast cancer surgery. It's really important to get diagnosed what's going on with your armpit before you start applying any of the treatment techniques I'm suggesting in this video, because it certainly could be not applicable. So if you are getting a sore armpit, go and see your medical team first and foremost and get a diagnosis as to why that armpit pain is occurring. What we're specifically talking about in this video is that period where you're 2 to 4 weeks after your breast cancer surgery, and the scar tissue is starting to consolidate and thicken, and that can start to cause restriction in range of shoulder motion. It can start to cause discomfort under the armpit. So that's one of the main reasons people after breast cancer treatment can get armpit pain. The second most common reason, of course, would be if you've had your armpit radiated. So if they've actually had to radiate this section, not just your chest wall, but if they've also had to radiate your armpit, then there's also the possibility as a latent or delayed side effect of radiation treatment that the tissue under the armpit here has thickened and tightened, and that when you go to raise your arm or do certain movements, that this area can become painful. So that's another thing to watch out for, guys. It's another version of scar tissue. So in difference to a surgical scar, we've got radiation scarring of the tissue. So if you've had radiation and you are 6 weeks, 6 months, even 6 years following radiation, there's the possibility that that is also a reason for your armpit pain. So in the second part of this video, I want to talk about how you can treat scar tissue, and this is whether the scar tissue is surgical scar tissue or radiation scar tissue or a bit of both. I should also mention as well that, of course, the main scar that is going to be influencing your armpit is the scar that is going to be sitting the closest to the armpit, which is usually the scar they've gone through to access the axillary lymph nodes. There are occasions where people are going to surgeons that are quite clever, and the surgeon sometimes can have made only one scar to access both the tumour to remove it, but also then sneak up into the armpit and remove the lymph node. So it's just aesthetically better for the person who's having a lumpectomy. Obviously this wouldn't happen in the case of a mastectomy, but if someone's having a lumpectomy and a sentinel lymph node biopsy, then sometimes dependent on the location of the tumour, they may only end up with one scar. But for everyone else, the scar we're talking about from a surgical point of view is the scar closest to the armpit where they've had to access the lymph nodes. So first of all, we use the treatment technique of massage. Now this can be either done by the patient themselves or by a physical therapist, physiotherapist, occupational therapist, or trained massage therapist who's familiar with working with breast cancer patients. I really can't stress that enough, that if you can ideally get to someone who's got experience with treating patients going through breast cancer, you'll definitely be in a much better place. They can really walk you through the whys and the hows and the whats, etc. when they're treating you. So when we start massaging, if you're a patient and you're going to perform massage on your own armpit, please remember just to keep it short and sweet. So ideally I would suggest you do less than 5 minutes, particularly the first time you do it, because you want to make sure that you don't end up making yourself really sore for hours or days on end afterwards. So use a mild to moderate pressure at most when you first try this, and then as you can build up tolerance, you can increase your pressure. So ultimately this does come down to how much you tolerate your own pressure, and it is quite hard to hurt yourself. So sometimes I am recommending to patients to come back and see me, because I can really appreciate it is difficult to apply pressure to yourself that's ultimately going to hurt. The really good news though is that any work that patients do in between physio sessions is really going to help the next physio session. So if you can do any soft tissue release or any massage to an area that's scarred, whether it's from radiation or surgery, it's really going to make your next physiotherapy session a lot more tolerable. So that's something to consider. So less than 5 minutes, once a day maximum as well, I would say, because if you pummel an area that is got scar tissue that's tight and sore in it, if you pummel that area too often, you might actually make it sorer than it needs to be. So just do it once a day, less than 5 minutes, pressure to what you tolerate, and certainly lower to start with and building up to increase pressure. And then fourthly, I would also mention that it's sensible to use a hypoallergenic cream, ideally something that's water-based, low pH, and obviously nothing you're allergic to. So something like a sorbeline, a mugu, a QV cream. This is obviously to lubricate the area and allow you to massage more effectively and not tear on any skin. So if a physiotherapist is doing the massage to you, then ultimately they're going to be able to probably push you around a little bit harder. But again, even if I'm massaging someone's armpit, I'm not going in there for 25 minutes. It's a small area, first of all, and it's often quite sensitive. So I can obviously get in there to what the patient can tolerate, but again, it's really individualized as to how much pressure I can use. It also depends on how long the patient's had this problem for, and how much pain they're in, so the higher the pain levels, sometimes the harder it is to apply firm pressure. But ultimately, any way you can start to desensitize that area, so any pressure you can get in there is going to be good. And often we find that the softer the tissue gets through any type of massage, the easier it is to do firmer massage anyway. So build yourself up slowly and make sure you're working with a therapist that you trust. You don't want to be going to a therapist who's just belting into your armpit and making you jump every single stroke they put in. It's just not going to do anything good for your trust levels and your confidence with that therapist. So just make sure they're working within your tolerance limits. The third and final thing I wanted to bring up in this video for a treatment technique is a wonderful stretch that I give all of my patients who've got any sort of armpit pain. So I'm actually going to stand up in a second and show you how to do this, guys. I've got a chair sitting right next to me, or more specifically, I've got the back of a chair right next to me here. Doesn't need it to be in the camera shot because it's not really necessarily relevant, and you'll see where my hand is lying. But if you've got a dining room height chair, if you've got a relatively high kitchen bench, anything that's at probably chest height or fractionally lower, that's going to be an object by which you can really perform this stretch well. So what we're trying to target, of course, is stretching out all of this area. So if I stand up now, I'll just show you that I'm going to place my hand, say we've got a tight left armpit, I'm going to place my left hand on the back of the chair and I'm going to slowly walk backwards. You'll notice that my right hand is not on the chair anymore, and the reason I'm suggesting this is you can actually walk one arm, like you can get more stretch under one arm if you've only got this arm on the chair. If I put both of my hands on the chair, I'm going to sort of limit what I can do with this arm. So I literally leave my other hand by my side. I'm going to walk backwards until I get a really good stretch through my armpit. Now, occasionally you will get people who will say, oh, I can't really feel anything here. So what I get them to do from this point, if they can't really walk any further back, is I get them to lower their chest wall towards the floor. And this is a really, really effective stretch for this whole region. You may even feel it into your latissimus dorsi muscle, even a little bit into your chest wall. But ultimately we're trying to target the armpit here. And you can stay here for a solid, 30 seconds plus. You can do a number of repetitions through this stretch. But ultimately, I think this is one of the best stretches breast cancer survivors and breast cancer patients can be doing on a regular basis, because so many people get profoundly tight through this region. So it may not even be that we're doing this stretch just for scar tissue. It might be for cording. It might be for muscular tension. There's a number of reasons I'll give my patients that stretch. But because there's so much tissue tension that can happen after breast cancer surgery, even chemotherapy and radiation, that's a very common stretch that I give out. So when you're doing it, like I said, make sure you're trying to hold that stretch for at least 30 seconds, build up your time, and remember that you only need to walk back as far as you can feel a really good stretch. So if you're really, really tight, you may find you only take a couple of steps back and you're already in a really strong stretch. If you are a bit more flexible, once you've walked back far enough, then you can start to lower your chest wall towards the floor and you should get a more profound stretch. Thank you so much for watching this video, guys. I hope you've gained some great information around how to treat armpit pain when it's secondary to scarring from surgery or radiation. If you have any questions on this video, please leave a comment in the section below and I'll get back to you as fast as I can. I hope you're having a great week wherever you are. I'm Jen McKenzie, the Breast Cancer Physio, and I'll see you next time.